The swing bed can be thought of as a transition from one level of care to the other. The acute care, you're only allowed to stay in that for so many days, and then there must be a transition either to home or to another level of care. And the swing bed is another level of care where we can work and make someone stronger. If they become weak, we just have a little more time to get them back to where they need to be. It is literally a transition from one level of care within that same room in the same facility to another level of care. We often receive stroke patients who have recently had a stroke and maybe been inpatient in another facility, or maybe even someone who may have recently had a myocardial infarction, or they have had a knee or hip replacement, some type of surgery like that. They need time to rehab before they go back to their home. Maybe their caregiver is not capable of totally caring for them at that time, but if they get a little strength here at our facility, then they can go home and be more useful to themselves. We offer physical therapy, working with strength and lower body. We will offer occupational therapy for their daily activities of daily living, such as dressing and brushing their teeth. We have respiratory therapy if they were in need of such. We have speech therapy for those who have had strokes or may have swallowing issues. We have skilled nursing care for those who require wound care or diabetic teaching or IV antibiotics, those type of things. We do have an interdisciplinary team. We meet weekly and we discuss patients, and that includes every discipline that's working with the patient, and some that are even not working directly with but have needs to know what's going on with that patient so that they can get the full benefit of our facility. We actually have made phone calls, whilst a patient is in here, to their surgeon or maybe to the person they might have an appointment with, or maybe even to their primary care provider for advice or records, or just to let them know an update on the patient. The benefit of being close to home is that family and friends can come and visit or stay if they need to. It's less stressful a lot of times on the patient if they are having some activity and visits from their family and friends. We find that people that actually have people who come and care and seem to be able to participate with the therapist during their stay do well. There's several ways that you can get admitted to our swing bed program. One of the ways is if you're already in our acute stay and we find during that stay that you need further treatment or strengthening, or maybe your IV antibiotics are not complete and you can stay for that. We also take patients from other areas such as Jackson, Tupelo. If they want to come back to Ackerman to receive care, they can request that and we can accept those people from those other facilities. Or if someone has a loved one and they just want to give us a call, our case management can look into whether they qualify for therapy here at Choctaw Regional Medical Center in their home area. If you're interested in more information about our swing bed program, call 662-285-4400 and ask for our case management department.